in the Eskenazi Health world, we have a lot of indigent patients that needed financial assistance. And we were trying to address how can we get them all screened at the time that they're at the hospital prior to leaving. Because once patients leave, I think we all know how hard it is to get them back. So what we did was implement with Experian to help us solve and screen the patients during their visits. Our patient population, how did we make sure that we were inclusive to everyone? And how do we make it patient-centered so that they didn't feel like if I turn these documents in, it may result in me getting in some trouble. We have a lot of undocumented patients. So we wanted to make sure it was patient-centered and we welcome them to be able to be open and honest and answer our screening questions. It allowed us to customize. So not only were we trying to solve for uninsured patients, we have a lot of underinsured patients. So the screening tool allowed us to customize with the questions that we needed to make sure that we captured all of our patient population. We wanted to have a 98% conversion rate on all applications that we submitted. And prior to moving to Experian, we did not have individual scorecards for our financial counselors or patient financial advocates. They now all have an individual scorecard, and they can see how many applications they're submitting, what their conversion rate is, and what their peers are. Very great. Very open, honest communication, very upfront and honest if it's something that they can't do. Implementation was a breeze. We worked very closely with our implementation folks to implement everything the way that we needed. And then the reporting, to taking us through the reporting and just having the tools and resources available to say we need to customize and do this, or we need to look at the analytics this way.